Good morning, everyone. I'm presenting the history of a 25-year-old unmarried Hindu male who has formerly studied till class 9. Father is a businessman. He is a Hindu by religion, living in an urban area in Dehradun, belonging to a nuclear family and upper class socio-economic status according to modified Kuppaswamy classification. His identification mark is a 2 into 3 centimeter black mole located 3 centimeters away from the left ear lobule and 7 centimeters away from the left nostril. 2 into 3 centimeter horizontal scar mark 5 centimeters above the right eyebrow. The informants are his 43-year-old mother, who is a graduate and currently a housewife, his 47-year-old father, who is a postgraduate, having done his BTech and MBA and currently a businessman. The history provided is reliable and adequate, with presenting complaints of decreased interaction and poor academic performance for 20 years, episodes of self-harm and aggression, one episode 20 years back, and increased since the past 2 years. The onset is insidious, course is continuous with no predisposing factor. However, precipitating factor for complaints number 3 and 4, that is the episodes of self-harm and aggressive behavior, is the change in residence from Delhi to Dehradun. Age at which the problem was recognized was 5 years. The patient was apparently well 20 years back when at the age of 5, his parents and teachers first noticed that when he started to go to school regularly, he would always pick up a corner bench and sit alone at the end of the class by himself. His parents also noticed a speech impediment wherein he would stutter to finish his sentences. Despite his teacher repeatedly insisting that he participate in the class activities, he would refuse and sit at one place all throughout the day. His parents further reported that he would never initiate a conversation with his cousins, children in his building, or in his class. He showed no interest in making friends. Even when someone would try to talk to him, he would simply nod his head and never respond to anyone with words. He would never share his toys with anyone and would play by himself with his toy cars. He would line them up neatly in a line in his room and would not let anyone even enter his room. His mother further reported that he would, on occasion, refuse to eat anything. His mother also reported that the teachers always found him preoccupied with himself. She would on occasion try to ask him questions in the class, but he would be unable to answer any. On being asked whether he was able to understand what was being taught in the class, he would always nod his head, but his marks showed otherwise. Although he would never flout rules, but he would also never inform at home about his homework assignments. Soon his scholastic performance deteriorated and he had to be retained in first standard. The mother further reported that he also never displayed any special interests and in his leisure time sat silently by himself, sometimes mumbling to himself. Even in class, he did not show any special interest to play with other children, although sometimes he would begin a task, but before finishing it, he would lose interest and begin another. It was during this time that his parents, now concerned due to his lack of any interest or activity, he was first taken to a mental health specialist. Subsequently, his father reported that he soon had to be shifted to a functional school wherein the main focus was speech therapy and reading. He studied in this school till 9th standard, after which he was able to solve simple arithmetic sums and read Hindi. He was subsequently then enrolled in an institute wherein he was taught Hindi, maths, and painting. Henceforth, his parents still reported a lack of initiative. The patient would, however, he would be very keen to drive a scooty. He would ride it around town, never flouting in traffic rules. But when he was taken to get a permanent driving license, he was unable to pass the test, after which he came back home and became aggressive with his father. This was the first incidence of violence. Apart from this one incidence of aggression at the age of 5 years, whenever the patient would be forcefully made to go to school in first standard, he would bite his arm and also scrape on his arm with a ruler. But after being withdrawn from that school, there were no further episodes of self-harm. The complaints of self-harm and aggression now arose in 2021 when the family was moving their residence to Dehradun, wherein he would slap himself on the face, arms, legs when asked to pack his bag, but the move was completed regardless. After moving, he had to share a bedroom with his younger brother, and despite always having a cordial relationship with him, he did not let his brother come inside the room. He started listening to music at very high volumes and would get physically abusive if anyone asked to turn it down. In one instance, he got violent with his mother and pushed her against the wall. when she insisted that he finish his food. His mother also reported that he started staying for long hours in the bathroom and would get aggressive if asked to come out faster. The instances of self-harm further increased, wherein now he would hate himself with more force, as reported by the father, if his whims and wishes were not fulfilled. His persistent, pervasive mood has been irritable. Negative history. No history of suspiciousness, hearing voices not heard by others, thoughts being introduced into, taken away from mind by external agency against the will, own thoughts being heard aloud or being known to others against the will. No history of sustained over cheerfulness, low mood, over religiosity, over familiarity, big planning. No history of compulsive acts, no history of eating disorder, no history of head injury, loss of consciousness, abnormal body movements associated with incontinence, tongue bite, frothing from mouth, and no history of any substance abuse. Treatment history. The patient was given treatment only since 2021 following his acts of aggression and self-harm. So he was started on capsule fluoxetine, which was taken up to 40 milligram, tablet oxcarbazepine, which was taken up to 750 milligram, tablet lurasidone taken up to 80 milligram, tablet trihexyphenidyl taken up to 3 milligram, tablet risperidone taken up to 2 milligram, and tablet clonazepam taken up to 2 milligram. He has not, ma'am, he has not given any complaints of repeated acts or compulsive or something. None of the family members reported that the acts of aggression they kind of increased after so many medications, and the patient would always be like in a sullen mood the whole time. So when he came to us, all of these medications were continued, but they were tapered down, all of them. For example, risperidone, lurasidone was 80, it was brought down to 20, and risperidone was increased to 4. Trihexyphenidyl was continued, oxcarbazepine was also reduced to 600, and fluoxetine was stopped. Now his family history. He's first in order out of 2 siblings of a non-consanguineous marriage. He lives in a nuclear family and has an intact family. History suggestive of depression in second degree paternal uncle. Personal history, prenatal history, and he was a unplanned conception, wanted child, no history of failed abortion, no history of bleeding during pregnancy, RH incompatibility, trauma, no history of gestational diabetes, hypertension, jaundice, no history of any X-ray exposure, intake of harmful medications or substance abuse, fever, infection, rash, or STD. Fetal movements were also normal. Natal and neonatal history. Firstly, up to 28 days, he was a full term, place of birth was hospital. However, the delivery type was a forceps delivery and there was prolonged labor. Presentation is not known. There is no history of any prolapsed cord. The weight was less. It was less than 2.5 kg and the head circumference was also small at birth. The child did not cry immediately after birth and the color of the baby was pink. There is no history suggestive of any congenital anomaly. Then up to 6 weeks, there is history suggestive of repeated infections as the parents told about the presence of a chronic cough. No history suggestive of jaundice, feeding problems, failure to thrive, injury, or convulsions. He was exclusively breastfed and weaning was at the age of 6 months. Developmental history, his gross motor, all the milestones were delayed except standing alone. Neck holding was achieved at 5 months and riding a tricycle was achieved at 5 years. Then language milestones, babbling was achieved at 7 months, disyllables at 1 month, 2 to 3 word sentences at 3 years. He was unable to tell a story, poem, or tell the meaning of any word. Social milestone, social smile was came at the age of 6 months and he could recognize mother at the age of 6 months. Immunization history was complete. Home environment, the parents had a house of their own. The patient had a room of his own. There is no history of desertion by a parent, broken home, step parent, or adopted sibling. Then scholastic history, normal. He was studying in a normal school up until first standard, after which when he failed, then he was shifted to functional school wherein he studied till ninth standard. And after that, he was shifted to another institute where he was taught Hindi, maths, and painting. Then currently, the patient can do addition up to 1,000 places, read in Hindi, and also paint. He was shy in school and did not participate in extracurricular activity. The sexual history of couldn't be obtained, no significant forensic history. Ma'am, in pre-morbid personality, I wanted to ask, since I have been giving history for the past 20, since 5 years of age. So what about this pre-morbid temperament? But pre-morbid is going to be when he was 5 years old. So what? What should we write in that? But ma'am, mother, he was okay. Huh. The parents also have a little recall bias or something, so they were not able to get. Nobody really noticed. His head circumference was small and he was quiet and everything. Milestones were delayed. So he was taken to numerous pediatricians, but they said that it's not a big deal. It can happen in a lot of children.
बिहेवियरल चेंजेस 5 साल के बाद आए तो वो हम अपने साइकियाट्री पॉइंट ऑफ व्यू से 5 साल से स्टार्ट करेंगे.
In general physical examination, he was an average built male. His body weight was 64, height 158 centimeters. BMI came out to be 25.70 kg per meter square. Pilorectalis clubbing cyanosis, lymphadenopathy, edema, dehydration were absent. No significant finding in systemic examination. In mental status examination, this was done on day 2 of admission. He was an average built male, entered the room unaided, accompanied by his parents, sat on the chair provided and returned the interviewer's greeting, had a fair complexion, bespectacled with cyanophorus, wearing a jeans and t-shirt with a pullover appropriate as per his surroundings, maintaining adequate grooming and hygiene, and looked as per stated age. Scanning his surroundings, uncomfortable and wanting to leave as soon as he was made to sit for the interview. Appeared to be in touch with his surroundings. Eye contact was not initiated but was maintained henceforth. Attitude was guarded. Rapport was not established. Psychomotor activity was normal. Speech was decreased in tone, volume, intensity with an increased reaction time. He was answering questions by nodding head or with 1 or 2 words only. Attention was arousable but was not sustained. He could do 40 minus 3 only up to 1 place. Then he was oriented to time, place, and person. In memory, only in the recent memory, he was able to recall what he ate for dinner last night. And apart from that, he did not comply when in the immediate or the remote memory.
Patient जो है लास्ट ये प्रॉपर उसकी अच्छे से पढ़ाई करेगी और लास्ट में वो हिंदी होता है
maths 1,000 places तक he can do. हाँ, that's why I did this.
तो एक बार कुछ और ट्राई करते हैं days of the week.
Ma'am, he was not compliant much about it. He started off with months of the year, but he could not finish it also. So I've mentioned 40 minus 3 only because that he could do it up to 1 place, but months he could not. Affect mood, sorry, the general information couldn't be done. Mood, he reported that I'm fine. Affect, the quality was flat affect. It had a fixed mobility with restricted range. It was non-reactive and not communicable. Thought, in stream there was poverty of speech. Possession was self, no form of thought disorder. And content, it couldn't be assessed. Then judgment test, he did not comply, whereas social and personal, they were not intact. As we could not get any kind of surety whether he will continue taking medications after leaving the hospital. And he was getting aggressive towards his mother and father. So that is how I tested for the personal and social perspective. Then his insight was of grade 2. Citing following complaints, he has been kept on a provisional diagnosis of autism spectrum disorder and a first differential of autism spectrum disorder with disorder of intellectual development with mild or no impairment of functional language.
अभी ठीक से करना से पहले बचपन
He is able to talk properly. Yeah, he is able to talk properly. There is a little stutter present in his speech, but otherwise he is able to speak properly. He can communicate what it is that he wants. For example, like I mentioned, he wants to ride a scooty and everything, so he can communicate that.
behavioral problems को लेके इसमें डाला है क्योंकि साफ साफ अग्रेशन का प्रॉब्लम और एक चीज ये एग्जाम करके पूछते अगर ये बता दो तो मैं उसका कैसे करना है ऐसा तो उसके भी डिफरेंशियल्स पूछे तो वो जिस सोचते हैं ना कि वही
Microcephalic process.
गरम गरम चीजें
He wants.
चीज बोलूंगा उसके भी तुमको कॉजेस भी पता होना चाहिए एग्जाम पॉइंट ऑफ हमारे सामने इस चीज के और नेशनल इम्यूनाइजेशन शेड्यूल का कई का शेड्यूल
अच्छा
हम बोल रहे हैं ना इम्यूनाइजेशन डन तो उसका शेड्यूल पूछ रहे हैं जो माइलस्टोन्स बोले कि डिलेड थे सोशल साइड कब आनी चाहिए इस बच्चे में शायद
4 months. 2 months.
ये चीज बतानी चाहिए ट्राइसिकल से 5 साल की मतलब शुरू
3 साल.
वो चीज वो पूछ लेते हैं ये आपने डिलेड आपके बॉडी का क्या एक्सपेक्ट करते हैं और बाकी तो तुम लोग को पता ही है एमएससी की डेफिनेशन हिस्ट्री सब कुछ ही लेंगे